My name's Peter Wood. I'm an obstetrician here at the Sydney Adventist Hospital and I've been working here since 2009. Well, we're blessed in Australia to have access to good food and a reasonably healthy lifestyle. We also have access to really bad food as well. So in general, in Australia, if you eat a balanced diet with fresh vegetables and a balanced calorie intake, then pretty much that's all that's required. And if you can exercise by walking half an hour every day, that also would improve the quality of your pregnancy. For people who are struggling to get the food in, then maybe some dietary supplementation could be a help. And in Australia, we like to recommend that all pregnant women take 0.5 milligram or 500 micrograms of folic acid or folate, same thing, every day, usually for at least a month prior to conception until the completion of the 13th week. That has been shown in many trials to reduce the incidence of neural tube defect, which is a significant congenital abnormality which can be avoided just by simply taking folic acid. So there is a special subset of women who need to take extra folic acid, and those are women who've had a previous history of neural tube defect or who might be taking anti-epileptic medication because that changes the way their body metabolizes folic acid. So they should be taking 5 milligrams or 10 times the amount of folic acid, and there are various preparations out there specifically for those women. The other dietary supplement which should be considered is iodine. Many years ago, this wasn't a problem in Australia because we had all the dairy industry used to sterilise all their equipment with iodine-based sanitisers, but someone high up in the powers that be thought that we should change that to a non-iodine-based sanitiser, and then the whole of Australia became iodine deficient after that. Now recommended that we take iodine supplementation because your baby's thyroid function is dependent on your iodine intake. In the first 2 trimesters, all the thyroid medication all the thyroid hormone that your baby gets comes from the mother's thyroid, but in the 3rd trimester, the baby makes its own thyroid hormone, and that comes from the mother's iodine. So it's important to have adequate iodine intake. In Australia, there are many preparations that have got folate and iodine, or you can take iodine, or you can get just iodized salt, or if you like eating fish, 1 serve of fish per week, or would adequately replace the iodine. The very last thing we should talk about supplementation is vitamin D. Vitamin D and calcium are connected. Vitamin D helps the absorption and metabolism of calcium. And strangely, another one of these strange things that's happened in our society, this never was a problem in Australia a few years ago, but then the slip, slop, slap anti-sunburn commercials came out, which was very good for reducing skin cancers, but in the process, all of that sunblock has now made a large proportion of our population deficient in vitamin D, because vitamin D is also, you access that from sun exposure. So you can either choose to have a 10 or 15 minute window every day where you don't have any sunblock, and the best time is between 10 and 11 in the morning, and as long as it's your sort of face and this sort of neck area, that is the best place to convert your vitamin D that you need. That would be adequate. But it's a sort of a 3-month process. It's not something just go out and do it once and suddenly you've got all the vitamin D you need. You need to be doing it on a regular basis. Or you can take a vitamin D supplementation, and you can easily buy calcium tablets which have got vitamin D in it. Calcium is something which you don't really need to supplement, but if you don't supplement it, the calcium will come out of your bones to supply the baby's needs, particularly during the 3rd trimester and in breastfeeding. So you need to have about 1,000 milligrams of calcium intake a day to adequately replace that. You can either do that with diet, dairy, cheese, meat has calcium in it, but it's also maybe easier if you're struggling with that to just take a calcium replacement tablet, and you can get that combined with vitamin D. In relation to the health of the fathers and the fathers-to-be, again, just normal healthy diet would be useful. If the husband or the father has been particularly unwell with the flu, or has had major surgery, or has had other sort of chemotherapy or some sort of recovering from some sort of treatment, there can be a 3 to 6 month lag for the sperm count to recover. Even just having the flu can be, suddenly the sperm count can drop for about 4 months. And so you just have to be aware that sometimes that can take time. But, and obviously cigarette smoking and use of recreational drugs can also reduce sperm count. So it's, if you really want to do the best chance for conception, then obviously it's best to stop all that too. To sort of maintain good body health by appropriate balanced diet, some simple exercise on a daily basis should prepare you well to help conceive your baby.